In December, we told you about the closure of Connect Clinic. That's the only virtual gender-affirming care provider in Ontario. Changes to the province's rules around virtual healthcare billing meant that Connect Clinic could no longer provide care to 1,500 active and 2,000 wait-listed patients who are transgender, non-binary, and gender diverse. 6 months later, Foria Clinic, a new virtual gender-affirming care provider from Connect Clinic and Purpose Med, is launching today. And Dr. Kay Greenaway, Medical Director of Foria Clinic, is joining us this morning. Welcome back to the show. Glad to have the update.
Thanks, Anne-Marie. It's so good to see you.
So Foria Clinic is now a collaboration between Purpose Med and Connect Clinic, which you founded.
Correct.
How did the partnership, first of all, come about?
I think we have a really nice origin story. The medical director of Purpose Med actually just reached out without knowing me, just saying, you know, we've heard about the struggles of Connect Clinic and we wanted to know if there's anything we could do to help. And it started a months-long conversation where we looked at ways to move forward, and ultimately this partnership formed from it. And we're moving forward today. And we're launching today. A very exciting day.
I'm curious about the reaction of these 1,500 patients who thought they were losing care.
It's been a really tough 6+ months for our patients, and we've done the best we can to kind of keep people with prescriptions active, but many people have been seeking new places for care, and lots have not been able to find it.
Yeah,
right?
I was going to ask you, what kind of impact did it have when Connect Care went away?
Yeah, when Connect Clinic closed, there was a lot of distress and panic, and actually just real sadness about losing something that was so important in people's lives. And many people just don't have other options. We talked last time about the rural and remote populations that really just don't have gender-affirming care in their community, and this was a real lifeline. So we're just really excited to have something new to offer.
Absolutely.
Yeah.
Can you explain the impact a little bit more about that virtual care has on the community?
Yeah, so virtual care is actually so important. One reason is geographic diversity in Ontario, right? We have lots of urban centers where people could maybe reach care a little bit more easily, even though there are long wait lists, but there's lots of regions in Ontario with no access to care. The other thing is, for many people in these communities, just traveling to an appointment and presenting an OHIP card that may not match who you are is really a traumatic experience potentially, and this avoids all that, right? They can connect immediately with a provider who understands what they're going through and can help them without all those barriers.
The gender-affirming care that you provide is facing growing threats south of the border. There are 19 states that have passed, we know, various restrictions, including gender-affirming care. Providers facing possible felony charges. This is happening in Florida. So as Pride Month is wrapping up, what makes the service Foria Clinic provide more important than ever? I saw you take a deep breath in when I started talking about those restrictions.
It's so sad. It's really awful to watch, right, what's happening in the U.S. And certainly we are aware of increasing transphobia at home as well. Makes it so important for us to have a service that offers hope for people. And
the barriers that they face, Dr. Greenaway, is it that they're being refused care? Is it criticism? What is it that they're facing that makes virtual care like yours even more so important?
It's a few things. You're exactly right that we are hearing from patients that they're being refused care, that people say, you know, they don't understand what's happening with them, or they just don't want to provide care for them. There are lots of primary care providers who are doing wonderful things for their patients, but it's also a lot to take on for a primary care provider if they don't have training or time to get training in a really taxed system, right? So this kind of provides an outlet for both the patients and the providers to have someone help out with this care. Some of the clients that you'd been treating before are aware of this news, but there's, as we said, 2,000 people waitlisted that are going to be really excited about this. What are you most looking forward to telling them? Like I said, I can't wait to tell them that there's a way forward, and that we have a new clinic launching today, and that the website will be active, and you can join us. Thanks so much. Come see us. Yeah, thanks so much for joining us with the update. Thanks, Anne-Marie.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.